Hi, my name is Ashley Cole, and I'm going to be providing you with the opponent view of punitive actions for medication errors committed by healthcare providers in the utilitarianistic view. Punitive actions against healthcare providers are aimed at upholding the safety of patients and preventing future errors from happening. Whereas medication errors cost the United States approximately $20 billion and account for over 100,000 deaths per year. So punitive actions may only have a short-term deterrent effect. Punitive measures need to be replaced. They need to be replaced with alternatives such as staff training, the use of modern systems, and counseling. Measures that can foster a safe working environment, something that is safe for both the medical staff and the patients. So we are going to explore just how punitive measures promote an unrealistic working environment and why alternative measures are necessary for promoting the safety of the patients. A closer look at this matter from an ethical perspective reveals that several core values are in jeopardy. The founder of utilitarianism ethics, Jeremy Bentham, says that for someone to be happy, they must be morally treated well. The ethicist argues that any form of mistreatment will lead to unhappiness. He maintained that human happiness is largely determined by how they are treated. The satisfaction of medical professionals is degraded by punitive actions imparted on them because of unintentional medical errors. As per the principle of impartiality, utilitarianism emphasizes common good and equality in all people. In other words, the good of one person cannot be more important than the good of another person. As medical professionals strive to save lives and improve the well-being of patients, their welfare matters as well. Medical professionals working in organizations that prefer using punitive actions against them were discouraged from reporting errors. Punitive actions instill fear and hinder the ability to exercise clinical judgment, thus undermining the autonomy of healthcare practitioners. Therefore, the principle of impartiality underscores the need to look into the interests of physicians rather than being skewed on just the patient's interest only. Utilitarians endorse welfarism too, with the view that the outcome of an action is determined by the well-being of the people affected by it. In this case, punitive actions are intrinsically bad to healthcare professionals. The Mayo Clinic published a survey showing that 6.5% of medical professionals had suicide thoughts in 2015 due to the stress caused by just the thought of punitive actions that they would be subjected to if they made errors. Punitive acts instill fear, reduce patient satisfaction levels, and obstructs any efforts to provide the best possible care. Punitive tactics dissuade medical professionals from engaging in delicate cases or disclosing problems. It impacts patient care negatively. The welfarism principle underscores that punitive actions are intrinsically bad because they devastate the well-being of all healthcare professionals. Another principle we are going to discuss is consequentialism. Consequentialism underscores that the value of the outcome or end result is what matters. In this case, whether to undertake punitive actions against medical professionals or not is important to examine the overall consequences of these punitive actions. People's actions, which might be perceived as wrong, could be the morally best options available depending on the time and context. Therefore, a medical professional who makes an error in the effort and process to save lives cannot be punished for indulging in such delicate cases. Punishment demotivates healthcare staff who are already under immense pressure to save lives.